You're all welcome to this YouTube channel once again. For new viewers, kindly click the subscribe button and don't forget to click the notification bell so you get notified each time a video drops on this page. Today we'll be looking at the surface anatomy of the abdomen. Let's get right into it. The abdomen in human anatomy is the body cavity lying between the chest or thorax above and the pelvis below, and from the spine in the back to the wall of the abdominal muscles in the front. The diaphragm is its upper boundary. There is no wall or clear-cut boundary between it and the pelvis. It contains organs of digestion and the spleen, which are surrounded by a serous membrane called the peritoneum. Looking at the skin of the front of the abdomen is thin. In the male, it is often thickly haired, especially toward the lower part of the middle line. In the female, the hairs are cut to the pubis. Of the iliac crest, especially marked in fat subject, is a shallow groove termed the iliac furrow, while in the site of the inguinal ligament, a sharper fold known as the fold of the groin is easily distinguishable. After distension of the abdomen from pregnancy or other causes, the skin commonly presents transverse white lines which are quite smooth. Being destitute of papillæ, these are known as the striæ gravidarum or striæ albicantes. The linea nigra of pregnancy is often seen as a pigmented brown streak in the midline between the umbilicus and the symphysis, the pubis and symphysis. In the midline of the front of the abdomen is a shallow furrow which extends from the junction between the body of the sternum with the xiphoid process to a short distance below the umbilicus. It corresponds to the linea alba. Then the umbilicus is situated in the midline, but it varies in position as regards its height. In an adult subject, it is always placed above the midpoint of the body, and in a normal well-nourished subject, it's from 2 to 2.5 cm above the level of the tubercles of the iliac crest. The umbilicus is the most visible structure of the abdominal wall and is the scar of the site of attachment of the umbilical cord. It is usually located midway between the xiphoid process and the pubis symphysis. The rectus abdominis muscle gives rise to the abdominal markings. The lateral border of this muscle is indicated by the linea semilunaris, a curved line running from the ninth rib to the pubic tubercle. Looking at the linea alba is a fibrous line that splits the rectus abdominis into two. It is visible as a vertical groove extending inferiorly from the xiphoid process. The muscles of the abdomen, which have considerable influence on surface form, are the external oblique muscle and the rectus. The external oblique is the largest and most superficial flat muscle in the abdominal wall. Its fibers run inferomedially. Then the rectus abdominis is long, paired muscle found either side of the midline in the abdominal wall. It is split into two by the linea alba. The lateral borders of the muscle create a surface marking known as the linea semilunaris. At the level of the umbilicus, the linea semilunaris is about 7 cm from the midline. The line indicating the junction of the muscular fibers of external oblique muscle with its aponeurosis extends from the tip of the ninth costal cartilage to a point just medial to the anterior superior iliac spine. Looking at the pancreas can sometimes be felt in emaciated subjects when the stomach and colon are empty by making deep pressure in the midline about 7 or 8 cm above the umbilicus. The kidneys, being situated at the back of the abdominal cavity and deeply placed, cannot be palpated unless enlarged or misplaced. The position of the inguinal canal is indicated by a line joining these two points. the surface lines. For convenience of description of the viscera and of reference to morbid conditions of the contained parts, the abdomen is divided into 9 regions by imaginary planes. We have 2 horizontal and 2 sagittal, the edges of the planes being indicated by lines drawn on the surface of the body. The abdomen is a large area, and so it's split into 9 regions. The abdomen is a large area, and so it's split into 9 regions. These are useful clinically for describing the location of pain, location of viscera, and describing surgical procedures. The 9 regions are formed by 2 horizontal and 2 vertical planes. Looking at the planes, we have the horizontal planes, which are the transpyloric plane and the intertubercular plane. Then we have the vertical planes. Looking at the horizontal plane, first we will take the transpyloric plane. It is found halfway between the jugular notch and the pubic symphysis, approximately the level of the L1 vertebra. Then we have the intertubercular plane, which is a horizontal line that runs between the superior aspects of the right and left iliac crest. We have, looking at the vertical planes run from the middle of the clavicle to the mid-inguinal point, halfway between the anterior superior iliac spine of the pelvis and the pubic symphysis. These planes are the mid-clavicular. They present a diagrammatic presentation of what I've said concerning the planes of the abdomen. Thank you for watching. Please don't forget to share our videos so we can get more viewers and more subscribers. Bye for now.